Hello, my name is Samantha Morales, and welcome to my presentation on Anatomical Terminology, Section 1.8. First, what is anatomical position? Anatomical position is the basic point of reference when concerning anatomy. This position starts by standing and facing forward, completely erect, with arms on either side of the body and palms facing forward. Next is superior and inferior. The superior part of the body relates to above. For example, the head is superior to the neck, and the neck is superior to the abdomen. The inferior part of the body relates to the part of the body below or under. For example, the feet are inferior to the knees, and the knees are inferior to the hips. Anterior and posterior. The anterior section relates to the front section of the body. For example, the knee is on the anterior side of the leg. The posterior section of the body relates to the back section of the body. For example, the anatomical position the elbow is on the posterior side of the arm. Next, we have bilateral. The bilateral structure is a paired structure on opposite sides of the body. These body parts mirror each other and split the body into right and left sections. Example would be the right and left leg, and the right and left arms, and the eyes. Next is ipsilateral. Ipsilateral is the opposite of bilateral. Examples of ipsilateral sections are the left arm and left leg, and the right arm and right leg. Ipsilateral is on the same side of the body. Next is proximal and distal. Proximal sections of the body are closer to the point of attachment. The shoulder is proximal to the abdomen. Distal sections of the body are farther away from the point of attachment. The joint of the wrist is distal to the joint of the shoulder. Next, I have superficial and deep. The superficial area in anatomy is the section closer to the body's surface. The skin is superficial to the muscles. The deep area in anatomy is the section more internal and farther from the surface of the body. The heart is deep to the ribs. Next, medial and lateral. The medial can be defined as closer to the midline of the body. For instance, the neck is medial to the shoulders because the neck is closer to the midline. Lateral can be defined as farther from the midline of the body. For example, the ear is lateral to the nose because the ear is farther from the midline. Next, I have body sections and planes. There are 3 anatomical planes in this. These include sagittal, transverse, coronal, and frontal. Sagittal plane. The sagittal plane splits the body into left and right sections. Next, we have the transverse plane. The transverse plane is a horizontal cut that splits the body into superior upper and inferior lower sections. Coronal. The coronal plane splits the body into anterior front and posterior back sections. You can see this on the picture on the left. Next, I have regions and quadrants. First, I just have the charts on this page, and I will go into more detail on the next slide. Quadrants and regions were created in order to help anatomists and doctors to be able to locate and precisely view which quadrant or section the area of discomfort is coming from, to narrow the possible organs that may be causing the discomfort. Organs of each quadrant. The right upper quadrant holds the liver, gallbladder, right kidney, a small part of the stomach, and parts of the colon and small intestine. The left upper quadrant holds the liver, the stomach, the pancreas, the left kidney, the spleen, and small parts of the small intestine and colon. The right lower quadrant holds the cecum, the appendix, the small intestine, the reproductive organs on the right, and the right ureter. The left lower quadrant holds the small intestine, the large intestine, the left ureter, and the left reproductive organs. These are my resources. This concludes the presentation on anatomical terminology. Thank you so much.